Doctor, what are the typical symptoms of coronavirus and how does this disease progress? Could you please share step-by-step details as to how one should deal with it in the family if they suspect something amiss? Thank you.
Coronavirus is a respiratory virus, so the disease will be predominantly restricted initially towards the respiratory tract, the upper or the lower respiratory tract. But for the first few days after contracting the virus, the patient might remain asymptomatic, and it can extend up to anything beyond 3 to 5 days. There might not be any symptoms at all. But thereafter, the patient will start showing symptoms, and the symptoms may range from there can be fever with sore throat, with cough with minimal expectorations, there can be dry cough, and along with that some may experience shortness of breath of varying degree. As the disease progresses from the milder form, which we usually get to see in around 80% of cases, the disease usually present with us in the milder form, and they just get cured within the next 2 weeks or so by just supportive treatment. It's only in the 10 to 12% of cases where we get to see that the disease is progressing towards the moderate to severe variety, where the patient might require hospitalization and ICU care as well. So in those cases, we get to see that there is gradual worsening of the respiratory signs and symptoms, like the patient might experience progressively increasing shortness of breath. Along with that, there might be requirement of organ support because of signs and symptoms of organ failure in the patient. For example, there can be complications like acute respiratory distress syndrome, something that we call as ARDS, or because of the worsening of the infection or sepsis, the patient might go into shock and multi-organ dysfunction. But remember, all these complications, these critical complications are usually seen in only 5% of the total number of cases, and the mortality in this particular subset of patients is usually on the higher side, anything between 40 to 60%. Otherwise, the coronavirus disease usually in 80% of cases presents in a milder form, which can get cured with just supportive treatment. So it absolutely depends upon the disease trajectory, starting from the milder variant to the moderate to severe variant to the very critical variant, which is coming to us in the ICU. So this is all about the different stages of the disease and the signs and symptoms in which the disease can express itself. Now, coming to the next part of the question that he has asked me is, what are the step-by-step details of how a family should progress if they suspect if something has gone wrong? See, if somebody in the family starts experiencing any of these symptoms, then it's better to consult a doctor as soon as possible, and then follow the doctor's advice accordingly. It's not that we are sending samples in every patient. We need a high index of suspicion in a patient. The history, particularly contact history and history of travel, is very important. Along with that, there has to be history of fever and upper respiratory signs and symptoms during our clinical examination. If everything matches, then definitely we are sending samples for investigation. For example, the Government of India has recently approved a blood test, which has been approved by the CDC. This is nothing but a screening test which can be done anything within the first 5 days of contracting the disease, and soon after the patient becomes symptomatic. And if this blood test comes as negative, then there is usually it's not required to screen the patient any further, unless you are having a very high index of suspicion that this patient might start showing symptoms within the next few days. Then of course you can go for further investigation in that patient. Otherwise, if the first test comes as negative, remember this is a blood test. We try to find out the antigen within the system. So this is a blood test that we do usually, and apart from that, the confirmatory test that we send is usually nasopharyngeal and oropharyngeal swab sample of the patient, and we get an RT-PCR testing done. So these are the tests that one should do if there is a suspicion of COVID-19. And within the family, if a case becomes positive, then obviously every member of the family, whosoever have come in contact with that particular person, has to go for a quarantine for next 2 weeks, and they are being closely observed for appearance of signs and symptoms. And if there is sign and symptom, then that particular family member has to undergo the test also. So this is all about Mr. Agarwal's question.